And that would be a very common presentation to our clinic is people, particularly on opiates or gabapentin, who just like, I'm not sure if it's doing anything for me or I don't like it, I want to be off it. So we try to work in conjunction with their physician because I'm not the one giving them that medication. I'm the one who's suggesting an alternative. And I don't want to necessarily annoy the other physician saying, no, this is junk or whatever, but clearly from the patient's perspective, they don't want to be on it anymore. So in that circumstance, I will always suggest a weaning pattern for the patient based on kind of science and how long the drug lasts. And there are actually some very good websites up right now helping people get off their antidepressants, their opiates, and giving you kind of an idea of how you should be tapering off these medications. For my patients, I'm able to use cannabis to help with some of the withdrawal symptoms, particularly from opiates. And that's been a kind of common theme echoed even in the downtown east side of Vancouver, that people use cannabis if they're having opiate withdrawal, and it can help with those symptoms. So as people are coming down off their opiates, they can use the cannabis to help deal with their pain and help deal with perhaps the nausea, the jitteriness that comes with the opiate withdrawal. And hopefully their opiates are coming down to a slow enough level that it's not being too unpleasant, but they can then use cannabis as a different tool, a more acceptable tool that leaves them feeling better in the morning, less residual impairment, and isn't likely to kill them in overdose. So I think it can certainly work out, and cannabis can be a really important part of people to give them something else to help them get off these other medications as substitution.